Hey YouTubers, what's up? Happy Monday. Listen, I had to get a new blood pressure machine right here, Omron 10 series. Okay, it is model BP785N as in November. Bravo Papa 785 November. This was recommended by Consumer Reports as one of the best blood pressure machines on the market. So I paid $69 on Amazon. The regular price is about $100, so I saved about $30. Um, when I signed up with Amazon, they included Amazon Prime, so you get expedited shipping. So that was next 2 days shipping, no extra charge, expedited shipping, and they enrolled me in Amazon Prime for 30 days. That's where you can get movies. Um, I don't know how much that is per year, but you get to download movies, some good movies. But anyway, I'm going to cancel that after the 30 days. Anyway, this is the new machine, and I'm going to show you how to work this machine real quickly. It's important, I think, that anybody over the age of 25 have a blood pressure machine. When you go to the doctor's office once a year or once every couple of years to check your blood pressure, that's not really accurate. Some people have white coat syndrome where their blood pressure automatically elevates when they see anybody with a white coat. But regardless, when you take one blood pressure test once a year at least, that's not very accurate. So with this, I am going to check my blood pressure on a regular basis. So uh, it's recommended that you check your blood pressure maybe before you go to bed, first thing in the morning, at lunchtime when you're stressed. Um, Different readings at different times, and then you get a more accurate representation of your blood pressure. Like I said, I'm going to show you how to use this machine. So let's get started.
So this is the owner's manual right here, 10 series blood pressure monitor, model BP785 November. And what we normally do when we get a owner's manual is throw that shit away. You should read the owner's manual, but I've already read it, so. And here's a machine right here. So you have your systolic, diastolic, gives you the pulse. I've already plugged in the cuff right here. Here's the cuff. The owner's manual says will take or measure an arm from 9 inches to 17 inches. So if you're a bodybuilder, be warned. This cuff won't fit your arm if you like to do a lot of bicep curls. You've been warned. Here is the adapter. Okay. Just plugs into the side over here, or actually at the back, but I'm not plugging it in. Okay. It does require 4 AA batteries, which I have in here. So you do have to get those. It doesn't come with it, and that's to store your settings. Okay. When you first put on the machine, before you hit the start button, because when you hitting the start button down here is you're ready to start taking blood pressure. But what I would do is go ahead and set the time and date. Okay. So before you do anything, just hit this button right here. Hit it. And you see here this flashing and number 2. Well, that's because down here I'm in number 2 mode. If I put it to number 1, it changes to number 1. And this flashing up here it says off. Well, you have the ability to take 3 blood pressure readings in 3 minutes, and then the machine will provide the average of the 3, which is not a bad idea. Okay, so you could turn this on or off by using this arrow. So if you press that arrow, it's on. I just switched it off. Okay, so but that's up to you. Press this button again and the date's flashing, 2014, and again you change the date with the arrows. I'm not going to change it. Press this button again, and here's the October the 20th. Okay, I'm not going to change, but again, it's pretty simple. change, change the month of the arrows. And I'm going to cycle it by pressing this again. Cycle it again. There's the time. Cycle it. There. And again, if you want to change any of those dates, you just change with the arrows. And I'm going to cycle it again. And now it's done. So my date and time is set. Okay. And so now you're ready to go ahead and take your blood pressure. So this is the correct way to have the cuff set up on your arm, with this tube from the cuff pretty much down the center of your arm. Okay. And of course going to the machine. So this is the way it should be. And the bottom of the cuff should be about 1/2 inch from your elbow. Okay, about half an inch from your elbow. But this is the setup. Now with the cuff on your arm, all you have to do is press the blue button and you're good to go. Sorry about the camera keep focusing, but hit this. And now it's going. I don't have my arm in there, so it's I'm not going to take my blood pressure. So it's giving me an error message. Okay. Now, if you want to see your historical readings, all you have to do is press this. You don't have to manually save your readings. It's automatically saved. Okay. Like I said, down here, you have 2 or 1. I'm in 1. And if you want to see all your history, you just press this button. So this is one of my readings right here. I was stored in a memory. Systolic was 125, diastolic was 80, and my pulse was 73. I think I had like 3 glasses of wine. So I was pretty much chilling, okay? And you can see right here, there's green indicators, meaning they were normal. I'm going to show you one where the indicator is amber. But you can just see right here at a glance that everything's normal in the green, okay? And I think this number is based on the American Heart Association numbers, okay? So I can cycle all my other readings. I've taken like 23 readings so far. This is number 23. You saw that. And now you see the green systolic, 127, but my diastolic was 85 with an amber reading. There isn't a red reading, or I haven't seen one. So I don't know if there was a red reading, if it would matter. Maybe you'd pass out, I don't know. And you have your date up here and the time. So I took this on October the 8th at 6:42 in the evening. The previous one was October the 20th at 3:29, and that's when I had 2 glasses of wine. I drink in the middle of the day, so that's it. That's my review of the Omron IntelliSeries blood pressure machine. It's pretty self-explanatory. This machine is really good. I find it very useful. And now I have a more accurate picture of my blood pressure.